feed issues. My name is Vincent Vichit-Vatican, member of the FCCT, freelance journalist, and member of the programming committee here. We have an excellent panel for you tonight, discussing things that are going on in the community, in Bangkok, in communities in need, and the grassroots movements that are helping people. We have, most of you will have already seen the program. Kun Chris is on his way. He should be here in about 10 minutes. But I will introduce Greg Lange and Friso from Bangkok Community Help, who are sitting in front. Kun Saks, who is sitting to my right, from SATI, and who would like to start with a brief introduction of yourself? Oh, sorry, a couple of quick housekeeping things before we start. If you have any questions, please feel free to add them to the Facebook Live feed. There are a couple people monitoring questions, and we will try to get to as many questions at the end of this panel as we can. So feel free to ask your questions at any point, but we will get to most of those at the end. And just again, to thank you for supporting and tuning in to the FCCT. There is a panel next week on the 24th. We will send you details through all of our social media shortly, but on the rapidly deteriorating situation in Afghanistan, and in particular the journalists who are there still on the ground. So with that, Greg, could I ask you to just say a few words of introduction before we start? And
Okay, thanks for having us. I believe you have a video. That video will be later on then, on the intro. But,
let's do the video a little bit later. Yeah.
Okay. Yeah. Sure. Okay.
Is your mic picking up?
Uh-oh.
One, two. Okay.
1, 2. Is that okay?
Let's put it in front of
All right, very good. So, I'm Greg Lang. I'm with Bangkok Community Help. I'm one of the co-founders, and we've been doing this, it seems like forever, but it was actually April 2020 when that first wave started, and wow, does that seem like a dream back then? What did we have, 30 cases, and everybody was panicked. But one thing that we did have at that time was much more of a lockdown, and there was much more of income issue, where a lot of people were not working and they needed food. And so that's what Bangkok Community Help is essentially does. If you go backwards, it's helping the community of Bangkok, and whatever that help is needed. And just like COVID has mutated, so has Bangkok Community Help. Anything that we never forecasted back in April when we started this that we'd be doing oxygen, or we'd be doing isolation centers, not in our wildest dreams. So, just like COVID has evolved, and so have we, and we have to do that, just like any business. A foundation is the same way. You must adapt. So
Hold that thought, Greg, because we'll get back to the business aspect of business skills that also are needed to
okay.
do this sort of effort. Saks, could I ask you to say just a word about who you are, where you come from, what you're doing right now?
Okay. Hi, my name is Sakson. Rouypirom.
Speak into the mic.
Sakson Rouypirom. I'm director and founder of SATI, nonprofit, grassroots nonprofit. We focus on healthcare and education for at-risk and underserved youth in Thailand. Around, when COVID started last year in March, a lot of our activities were suspended. So we're also part of a community called FREC, the Ford Research and Engagement Center. So during that time, with a bunch of NGOs and social enterprises, we were able to start Covid Relief Bangkok. Since last year, we donated over 1 million meals. We started a mental health training program. We have an upskilling program, so we've been kind of working as a big group with tons of volunteers and a lot of organizations working together to kind of up till now. We thought it would be a lot better by now, but it's still pretty intense.
We were all hoping it would be better by now.
Yeah.
But joining us remotely is Kun Sarawit, Kun Champ, could I ask you to introduce yourself as well?
Yeah, thank you. Hi, everyone. My name is Sarawit Limopat Punsawat. I'm actually a specialist for charity management and development in the international context. I have just moved back to Thailand when the COVID just started because I went to study master and PhD in charity management in the UK for 6 and 7 years. Before I moved to the UK, I worked at American Chamber of Commerce in Thailand, focusing on the corporate social responsibility, committee and activities. And then I moved to work with Lange and Foundation Asia, where I organized Thailand NGO Awards for 3 years, and then focusing on the NGO and charity capability and capacity building. And now I'm conducting my PhD thesis, focusing on the collaboration between Thai charity and multinational corporation in Thailand as well. In the past 2 years, I've been working with a lot of NGOs and charities, including some network, for example, the Food for Fighter, to address the pandemic. So I'll be telling more about my story later in my section. Thank you.
Just to point out for any of you who were watching about a month ago when we did a panel on what the restaurant industry is doing to help during the pandemic. Food for Fighters was one of the guests. Kuntete was one of the speakers, and that was during one of their drives and one of their food distribution efforts that I met Kunchap. So with that, would you like, since you are something of an analyst and expert of the field, would you like to give us some background on what's happening right now and on what these foundations are doing and how they're doing it?
Sure, thank you. Thank you for having me first. For today is my first speaking at FCCT, even though I've been there so many times, listening to my friends and my boss speaking at FCCT. I would say that today, I actually wanted to do the presentation, but I think it's going to be very boring. And I think with this amazing speaker from SATI, from Bangkok Community Help Foundation, and Sendai is coming as well, I think it's going I don't want to have a presentation. I love to have the open discussion. So what I'm gonna say today might be right or wrong. So please, Kun Chris, Mr. Greg, Mr. Friso, and Zach, if you'd like to add something, please feel free to do that. I love to have the discussion and to build deeper and clearer understanding of what is happening right now in the sector and in Thailand and during the pandemic as well. Today, I'm going to address 2 big topics. The first one is the challenges for the charity sector during the pandemic, and the second one is going to be the skills or the suggested solution that charities or NGO should have it to survive and address the pandemic as well. Let me start with the challenges. The first one, I think, is pretty boring to talk about fundraising and funding for charity sector, because since I have to remember when I started working in the charity sector 16 years ago, 17 years ago at Amata Foundation, I remember like every year I need to write a proposal, and then the first paragraph of my proposal should be like, the economy is dropping down, and so the charity and the NGO have less income or less donation. But this time it's totally different. When I was doing the the proposal for the COVID-19 pandemic this year, I was thinking that looking back 15 years ago when we had tsunami in Phuket, 16 or 17 years ago, I don't remember, that situation is totally different because a night after tsunami hit Phuket, Phanga, and Krabi, a lot of funding from every corner around the world came to Thailand. And at that time, Thai NGOs and charity, they didn't even know how to manage the funding because it's just too much. But this time is totally different because under the pandemic, donors, a lot of donors became beneficiary themselves. We cannot deny that. Those who have money have less money. Those who have less money got no money recently. So the funding of the for the charity sector as a whole has been dropping. Let me give you an example. Every country GDP seems to drop this year, and even Thailand, we are waiting for the announcement for the government. But I suspect that the GDP of our country this year is going to be minus. It's not even 1% anymore. What does it mean? The corporate sector got less money. So the donation from the corporate sector that normally donate to charity and NGO sector will drop even more end of this year. I'm not talking about the COVID relief, I'm talking about the charity in general as a whole, because they don't have enough income, and some of them shut down, especially the airline sector, hotel, restaurant, those, turn bankrupt eventually this day. So once the corporate sector have less money, the government also got less tax, so they don't have money to donate the donation to the charity sector. And also, at the end, we cannot deny that individuals, donor, also have less donation. If you go back, if we all remember the first wave of COVID-19 in Thailand, at that time we only have 100 infected. I still remember a lot of people came out to make donation, buy masks, to donate to the hospital, to the people who live in the slum, people still sharing food. On the street, we got like a food box and also the food space, the food shelf for people to share. And that also done in the second wave. But this time, every day we've got the number of the infected patient of COVID-19 increasing every day, like 20,000 people. And what does it mean? It means that this pandemic make a huge impact to individual donors who live in Thailand, outside Thailand as well. A lot of my friends who got job, lose their job. A lot of my friends who eventually have their job got infected. They need to stay in hospital and pay for the treatment by themselves, and they don't have money to donate. Even though we've been talking that in Thailand, Thai people are very kind and generous to make the donation all the time. When we have any disaster or any event that happens, Thai people would be, one of the first country that will donate money to the vulnerable or the poor themselves. But for COVID-19, they don't have that performance to donate anymore, or it becomes less. So what's going to happen with the charity sector? Everyone knows already. Once the charity sector got less money, got less donation, it's unlikely for them to survive. Some of them have laid off the staff already. Some of them have minimized the size of the project, and some of them cannot even, pay for the rent or survive during the crisis. I've been talking to a lot of charity, and that sounds very scary, but it's true. It's really happening right now. For those charity who don't adjust themselves and adapt, as Mr. Greg has said at the beginning, that if you don't adapt, then you definitely die during the COVID-19, because the donation also, drop, and you cannot help the poor that you have been helping, because now everyone is focusing on the pandemic. So the only way to maintain the income for the charity sector now, I might suggest personally that you need to work with the COVID-19. So this is going to move to the second challenges, mission mislead and mission failure. It has been a lot of critique of the charity sector that if, for example, you are the NGO who work with the environment, you are the NGO who work with the education, you are the NGO who work with the financial literacy, you help dogs and cats, you help women at risk. If you change your organization mission, is it doable? Is it a right thing to do to maintain your income stream? Is it a right thing to do to make, help your organization to survive during the pandemic, just to create the fundraising campaign along with the COVID-19? I must say that it could be and it could be not, because your question, the question that I must raise to the charity sector is, who is the poor for your organization? Who is your beneficiary? What's your organization mission? And during the COVID-19, have your beneficiaries got affected by COVID-19? Are you able to identify those problems? Are you able to link those problems and then help your beneficiary? And that could be your marketing campaign as well. The question is that, have you changed your core value to your organization? If you change your mission of your organization, my answer is no. You still have your mission, but you need to identify and link COVID-19 to your organization mission. And once the pandemic ends, then probably go back to as usual. I have talked to my friends who work in the charity sector. It seems like a lot of charity sectors stop or reduce the focus on the development project that they've been doing for years, but now doing the emergency relief, not because only they want to raise more funding, but also we have to realize that COVID-19, is causing a lot of damage to everyone in every perspective, financially, physically, and mentally. So the organization should be able to define those problems and change immediately. What I would suggest from the two challenges to the charity sector, the first one, you need to have the sense of urgency and sense of priority. Even though you have the poor that you're helping, but you need to define who is the real poor under this situation, because every day that you are slow, everyone is dying. People are dying every day. It's a matter of time. So if you have the sense of priority, if you have the skill of priority, you can change and see what is happening and move very quickly. This also includes the marketing campaign or fundraising campaign to the organization as well. From my research, I heard that international organization donor from abroad actually do not donate more in the past 2 years, and and they don't seem to donate more as well in, next year. What they ask the recipients or NGO or charity in this perspective is to focus more on the COVID-19, and that's the challenge as well. Corporate donors used to donate to NGO and charity in Thailand about 30% maximum for each organization. And if you don't focus on COVID-19, you don't adapt, they seem to donate more because they're now focusing on COVID-19 as well. So I talked to the food for fighters. They set up the corporate donor stream from their donation is increasing from 30% to 50% in the past 6 months for doing the emergency relief to the people who got infected, and also for the frontliners as well. And also individual donor. This is so interesting. Individual donor donate less money since June last year, from 70% to 60%, 50% to 40% in some organizations I've been working with. But every time we got the sensitivity, we got the sensitive issues in the news, in the media, they likely to donate more. For example, when we have the numbers of the infected in Thailand, when we jump from 8,000 to 12,000 K, the individual donors seem to donate more money because it might touch, their interest or it's a bit tragedy but to say, but I think they know this is very severe and they need to help, so they donate more money. And the interesting as well from this individual donor stream is that we found out that the powerful donors are baby boomers somehow. I think it's because they are, first of all, of course, they are in the age that they are able to donate more than the young generation. And second of all, I think they know that they need to act, they need to move to help the countries and other people. So this is quite interesting, and I hope it's helpful. For the second solution, I have mentioned already that the charity sector need to move fast and need to go lean. And this is like the business perspective kind of, but it's true that if you are slow, if you still spend 6 months to develop one proposal, you won't survive. Now people, no one gonna wait for it. People dying every day. So you need to move fast. You cannot move, you cannot have the macro move. You need to do the micro move. And that links to the third suggestion, cross-sector collaboration. When you are lean, when you move fast, also you cannot work alone. No, a single man show is never big. I will end this section with this suggestion. As you can see now, a superstar of helping COVID-19 in the media, and people talk about it. Sendai, Food for Fighter,เราร่วมใจ, Bangkok Health Foundation, even SATI. Why? Because they collaborate. They don't work alone. It's because nowadays there are no more resources, but increasing demanding. People asking for help, but less resource. If you work alone, still waiting for funding, it's not going to happen. Only charities, NGOs, and networks, of people who collaborate survive this situation, and that also makes such a big impact in the country. If you notice, these people who gather together, work with at least, Food for Fighter work with at least 50 organizations or networks. Also, Sendai work with at least 30 to 50 stakeholders to make it happen. Otherwise they cannot address the pandemic. What I've been doing with the government when I talk about collaboration, since last year, I asked the money from the Community Development Department, Office of SME, and also National Housing Association as well for some funding. And I used that funding to help community entrepreneurs, small business, and also people with the low income to sell stuff online. And I matched them with the Shopee, Lazada, and other online platform, because now, as you know, the department store closed. Most of the market closed, and people who actually, not sick yet, but no money to spend in their family, got no place to sell stuff, got no place to sell money. So I also, use that money by matching the government with the corporate sector and link with the civil society to do such a project as well to address the pandemic in terms of the economic perspective. And that's all for me. And I love to hear from the other 4 speakers as well, Vincent. Thank you.
Thank you. Thank you so much for that. That was great to cover so many points about fundraising, about reactivity and speed, about collaborating and pooling resources. I'm sure that we'll have loads of questions for you at the end of this discussion, so please stay with us, but thank you very much. Who would like to go next? Sax, would you like to say a word about?
Sure.
Okay. About what you do? Go ahead and start.
Okay. I guess I'll start from last year. So with SATI, we work with 2 groups of kids, underserved and at-risk youths. So I do a lot of traveling within Thailand. I work in Mae Hong Son, Chiang Rai, Isan. And then in Bangkok, we work with a lot of youth centers. So detention centers, drug rehabilitation centers, shelters. So once COVID started, everything started. It was a real lockdown, So it was really hard to maneuver. I couldn't travel. I couldn't go to Mae Hong Son. We were supposed to build a dorm. I couldn't go. I couldn't even go to our youth center. We do a weekly pop-up clinic in Hua Lamphong. I couldn't go there. The center was closed. So my initial reaction was, do we wait? I remember this was around like mid-March. So do we wait? But then every day, like I'm getting calls, I'm getting
This
questions.
is mid-March 2020, right?
Yeah, 2020. Yeah. So I'm getting calls. They're like, what's going on? What should we do? And we're SATI. We're very lucky to be part of for research and engagement FREC. So within that area, it's in Nang Leung. So there's FREC. There's Bangkok 1899. It's pretty much a community of NGOs and social enterprises. So when this problem came up, I spoke to Scott, who is the director of Ford Fund, and we're good friends, and we're like, what can we do? Something that I've always been very adamant about is SATI, we don't believe in giving stuff out. I don't believe that solves any problems. We believe in empowerment and sustainability, but I mean, like people, they're locked down. People who there's so many people in Bangkok who work in the morning, they make an income, they're living, and they buy their food, like garbage collectors, a lot of garbage communities, they use that money to buy food per day. So I mean, literally people didn't have money. So I mean, the first thing we had to do is we had to find supplies, So we started with dry supplies like rice, masks, soap, sanitary supplies, canned fish, and luckily with FREC, so we spoke to Scott. Within the community, we have, the first question is, where do we go? I'm a very strict. I believe in like planning. Data is important. We have to have data. So within FREC, there's an organization called USL, Urban Studies Lab. So Urban Studies Lab works with, they work with the government, they work with communities, they do urban planning, they do urban research. So they have so much data. So I talked to Achan Pan, who's the director. I'm like, we need to know where to go. Everybody needs help. So what USL was able to do is they were able to get information from the BMA. So we knew with COVID, there's three really like at-risk factors. One is age. 2 is living in confined spaces, so tight spaces, and 3 is income. These are 3 things that tend to have, but there were no statistics for COVID yet because we just, it just started. So what USL did is they took these 3 data points and they mapped out all of Bangkok. So let's say, if you have, you have a high elderly population, maybe you're a 5. But if you have elderly plus, they call it at in Thai, so like close quarters, then maybe you're a 6. But if you have low income plus so then you become like a 9 or it's 8. So we mapped up all of Bangkok, and we use these data points to know where to go. So after that, it's like, how do we go there? Within the community, there's also SOS. SOS handles food surplus. So what they do is they collect from hotels, 5-star hotels, supermarkets, and they use this food surplus and they donate to in-need communities anyways. That's what they normally do. So other hotels, everything is closing, so they have all these cars now. So now, okay, we collect, and now we have the transportation system. So after that, we have to go to these communities, but we have these huge numbers because the numbers are in the thousands. So how do we know how to give them out? How do we know even if the people really need them? So our next, working in Nang Leung, we have a good relationship with the district office and the community health center. So Community Health Center 20. So every district has their own community center. So we started off in Nang Leung. We started off with about 340 packs that supply food for 340 families. And then from there, we just went on following the map. And the fact that we already work with the district, the health office, they were able to link us to the next health office. So now when we go to the health office, we're like, okay, we're gonna go to Bang Bon, let's say, which is a red district. We contact the community health center and we're like, okay, we're coming with supplies. How many do you need? So with every district, they're called Asasal. In Tang Changwat, it's called Asamall. So community health volunteers. So they live within the community. So they'll send out the information for us like, hey, within our 200 people community, 100 people need help. So they send them back. We get the supplies ready. We go to the health centers, and then we have to train. Remember, this is like last year, so people didn't even know how to handle COVID. Traditionally, the way Thai people give stuff out is they like to take selfies. That is not a social distancing protocol. So we had to go to the health centers and we had to do training. Okay, so when you give out the stuff, this is this is the risk. You wear a mask. You have your gels. It's distancing. We had to train them there, and then they would go into the communities. We also had to keep data. So for me, it was always like, what's the next step? It's not, how do we recover? It's not just about giving, what's the next step. So within every pack, we have a QR code. So the QR code is something that when the people get it, they have to scan the QR code. And through that, we send surveys. So we get information on what's going on in the communities. So we did that, last year, and things were actually starting to get better, by mid-year, we were like, okay, let's plan the next step. And the information that we got back from the communities were two main things. One, mental health. So if you look at the statistics globally, within the COVID time, there's been an increase of suicides. First, it's important to understand that COVID does not cause suicides. Stress causes, So people who are normally not in the proper mental state, maybe they have mental health issues or they may have stress. COVID is an additional, it's the biggest stress in the last century, So there's people who in the communities who were, we're getting feedback that they're not, they're stressed out. They have high anxiety, they have depression, and there's high rates of suicide. So we started with, we linked up with different mental health organizations, and we started doing mental health training. So every week we would have those same health volunteers from every district. They would come in, and we did something that's called psychological first aid. It was run by a mental health expert called Sanju. We would do basically listening skills. Like if someone's like, I'm in debt, what should I do? The worst thing you can answer is wait it out, which it's the Thai way, it's going to get better, but that only adds to mental anxiety. So we would train over 300 mental health volunteers. Along the next problem we faced was jobs. So people who normally sell, let's say, noodles, and they make maybe 3,000 baht a day. All of a sudden, they're making 500 baht. So their question is, when is this going to get better? And my answer to them is like, I don't know. So how do they make more of an income? Actually, the gentleman before actually kind of spoke this. It's interesting. How do you make more income from what you're already doing? So we ran a 3-month boot camp for 10 communities about upskilling. So do they sell their food on Grab? A lot of people actually don't know how to use Grab in these communities. Do they do like these nice videos where they're rebranding? Do they do nice packaging? So we ran a boot camp for 3 months doing that, and then all of a sudden this next round comes. So up to all this now it's March, April, and we're hit again. So we stopped on the mental health training because we need to get people together. We stopped on the boot camp, and we're back to distribution. So just from last year to October, we did over 1 million meals, and now we're back at it. We're out like 3-4 days a week. We have amazing organizations help. Ford Fund helps us with cars. We have Ford trucks carrying stuff. Something that I left out, which is most important, is also the volunteers. We've had so many people volunteer since last year, like hundreds of volunteers. So. I don't know. I forgot what the question is, but
No, that's fantastic.
Yeah.
Can you just say a word about, and because your background is also from the business world.
Yeah.
How much does that inform the way? Because you talk about lots of things that in a business context would make sense. You talk about having data to make decisions. You talk about supply, about logistics. How much did that inform how you do what you do at SATI?
I think so. I have two main things that I'm semi-comfortable. It's food and beverage. Like I grew up in restaurants, and the second thing is medicine. So I worked in healthcare for a long time. So with SATI, we're working for about 10 years, and I've always been like data driven. We have to have a plan. So with COVID, we're just kind of we're jumping back in. Before he mentioned something about donations. So when this, the issue came up, none of the NGOs wanted to accept money. We're like, this doesn't fit SATI's profile. This doesn't fit So what we've always done is we have another partnership called Social Giver, which is we use them as a crowdfunding platform. So by using them as an intermediate, they audit everything. So all the monies that's been donated. It goes through Social Giver. They audit it, so we have to have receipts for them with rice, everything. So I think that with that type of organization, we've actually been getting a lot of donations since last year, both monetary. It started with private donors. So I knew the direction had to be starting with private, and then going into business, or starting with individual donors and going to business. But I also know from working in this field for a very long time that most companies are very slow, because they have to go through their steps, right? They have to approve. So when COVID started out, we have a place called Bangkok 1899 that we work with. We started off with just physical donations. Every day, people would bring their cars and they would just drop off the stuff in front. Bags of rice, bags of fish, cans of fish. And if they couldn't, they would, everybody's at home. They would just call Grab and drop off rice. So literally for the first 2 to 3 months, we used zero money, zero. Because all the NGOs, we had our vehicles, we had our staff, so we didn't, you didn't have to pay them extra. We didn't use any money. So along those 3 months, we have a time for all the corporations who actually, contacted us, for them to actually do their due diligence to make sure that, hey, we're doing our work. So after those 3 months, then we started getting both kind donations and monetary donations. So whatever makes people more comfortable, if they would rather just send the money or if they'd rather give kind. So I think we've been very lucky because everybody's wants to help. So we've been very lucky. Yeah.
And did you, to get that help, did you have to tap into your networks? To get the individual donors initially and then the corporate donors later? How did that process? Did it happen organically, or did you have to pick up your phone and send emails? And
ironically, the gentleman also mentioned this before, which I was listening and I found really interesting. So I've been doing SATI for like about 10 years, and we get very little donations, but that's kind of our goal. Our goal is not to get just donations. Our goals are, I do social enterprises, we do activities that actually raise money. With Covid Relief, so SATI we work with kids. With Covid Relief, we're doing one thing. We're working with COVID. So all of a sudden, I have these people that I work with, networks. I work in environment. I work in like healthcare. I work in many different fields, where normally people are donating to different sectors. But now everybody's like COVID. So the beginning of COVID, things were just pouring in, and people were just telling each other. It was a really, really, really like amazing feeling. You have all these people who really want to help, So it started with that, and then people. Last year we got close to, I think, 3 million baht donated cash, and then in kind, I think doubled that, way doubled. That's just last year, and it's all. And we use everything. We have receipts, that 3 million was gone last year. We were doing, by the end of October, we were doing 2,500 families per week. From the first week, we're doing 340. By the third month, we're doing 2,000 per week. So if you count 5 kg of rice at an average of, let's say, 150 baht, times 2,500, how many tons, how much money that is per week. And it was a machine, it was just going quite fast. And part of it is, I think, people who know SATI. I think I've been lucky to we're very small, but we don't have a lot of followers, but the people who follow us always support. And then you have, SOS, and you have USL, and you have Ford, and you have Bangkok 1889, and you have now projects. And it's just like this one, it kept on like snowballing from that. So, yeah.
Excellent. Thank you so much. I'm sure we'll have plenty of questions for you after this.
Thank you.
Next, Kun Chris, if you're, first of all, welcome. I'm glad you could join us, that you could join us here. You're even newer at this than, we were talking about things that started last year, but Sendai is even newer, isn't it?
Yeah, I think Sendai started 3 months and a half ago. 3 months and a half, yeah.
Could you tell us a little bit about what you do and how you got into, where you come from, and introduce yourself first.
Okay, sure.
And then tell us a little bit about Sendai.
Okay, so I am a lawyer. I practice in corporate laws. Sometimes I draft contracts. I look over documents for firms. But what I mostly do in my free time is also I'm very active in the community. I used to run for a member of parliament a little over than 2 years ago. So that's how I got to roll down, in the very low income communities in Bangkok. Mostly for the communities that we work with are like where before Sendai was Rajtevi, Payathai, and Chatuchak. And that's how I know that last year when COVID started, we kind of work as but that organization is just Chris who helped the low-income communities around Ratchathewi, Payathai, and Chatuchak. At that time, what
were you doing? How did you?
What did I do
personnel?
there? So I just announced online that, hey, my friends, almost anyone who knows me, I know that these communities that I work with they all affected by COVID. And last year it wasn't the disease itself. It's just the lockdown that limit opportunities of those people who in the low-income communities, they don't have a chance to work at all. Most of them, they work as a muscle of Bangkok. They ride motorcycles. They are taxi drivers. They work in restaurants. And that when I started to work with COVID. So that time I started a project called Thung Chu Chai or something like that. And I felt that it's more like rice, one bag, 5 kilograms of rice, 1 liter of cooking oil, 10 eggs, and like 10 fish cans. And I sell that online for like 200 baht. And with little surprise, I sold more than 6,000 these bags. And I've been give out to all the people who are affected by COVID last year. That's how I started. But I didn't expect that I'm gonna need to be the emergency helpers. I need to go into the houses of people who are affected by COVID, who have COVID disease. I didn't expect that at all. What happened in April was that I met one person. He's a friend. No, he's a brother of Kun Ap, who's a gamer, and he has COVID. He couldn't call anyone. No one picked up his phone. He couldn't find transportation. And at the end, he passed away because of COVID-19. I met his brother, and I was talking to him, and I couldn't believe that a guy like him he just looked like me. He's he's not poor. He's a middle income guy, average, 30 average. And there's no reason for him to die at all. That's the first thing. So I talked to him and be like, if he couldn't find transportation, this is super easy. COVID couldn't go through the mirror. So I have a pickup truck. Let's use that pickup truck to transport COVID patients. Just like that. I didn't have any other ideas more than that. And okay, so I first started from that one pickup truck, put a carry boy, it's more like a cab, it's like a roof in the back of pickup truck, and I posted online for people who want to donate old cell phones. We all change iPhones every year. There must be some used iPhone in the world somewhere that nobody uses it. I posted, and I think in a day or two I get like 10 iPhones. And so me and my friends, like a little over than 20, we started just like that. Starting from transport infected people to the hospitals, or patient under investigation who might be sick, who might have a cold, but he might have a high risk in COVID, contracted with person who have COVID. So we started from that, just bring those people to the testing stations. people like Kun Up. We started doing that from the first day. I think first day we sent like 10 people to the testing station or to the hospitals. And after that, it just keep rolling and rolling and rolling.
Can I ask, at what point did you realize that one pickup truck, a couple of bags of food, and a few mobile phones, at what point did you decide to scale up and that you needed to organize into
An organization.
an organization like Sendai? What was the moment, or was there something that made you say,
Okay.
we need to turn this into an actual operation?
Okay. So I don't think there's that kind of moment. It's just the first moment that I talked to Kun Up's brother, Kun Kulachet Watanapon, and also, okay, there might be one point. On that day when Kun Up died, on the next day, Kun Up's mother couldn't find a testing station. She went to one private hospital, and the hospital just denied testing, just like that. So I'm the one who actually went to that hospital and start negotiating with that one, and I successfully convinced the hospital to accept Kun Up's mother to get tested. So I realized that I'm capable of doing this. That with the right kind of negotiation, we could help people to get into the system. That might be the point that I started to think that I could do more than just buying stuff and giving stuff away. So that's I think that's the first moment that I feel like, and after that, or on that day, I think the strategy that I used was I asked the hospital why they couldn't accept Kun Up's mom to test, and the hospital start to say blah 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 and blah, you know, and at the end I realized it's just one rule that stop everything, which any hospital that accept testing, if the patient turn out to be positive, then that hospital need to accept the patient. And that at that time, the beds are not full. The hospital beds are not full. And why couldn't they accept Kun Up's mom? Just only one thing. I asked them, and it started to feel like it's just the hospital are worried about how they could claim the money back from the government, from the Saposachor. COVID treatment in Thailand are all free, but it's not that the hospital are do it for charity. Hospital treats everyone who has COVID free, but they charge back to the government.
So they get public funds for the treatment.
Yeah. So at that point, I started to ask hospital, like, now the rules. I use that rules that you deny testing because you're afraid to accept her. Is that right? And I started to convince them that maybe she might have COVID, maybe she might not have. But even if she have COVID, we will provide full support, full payment on Kun Up's mom. And the hospital accept that. So I start to realize there's something wrong in the system, in the COVID system.
Would you say that the problem, the something wrong, is a question of policy or?
Yeah, it's a question of policy. Question of policies and rules, and so so I know that there's a problem happen and I can solve that there. So I know that I need to start to do more than just one patient. I can help more than that.
Would you say, I mean, so a variation on the question I asked Kun Sachs was about, you know, how
That-
much his business background informed what he's doing now.
Yeah.
What can you, with your background in politics, would you say that influenced how you approach this problem?
Maybe, but I think what happened was I know law. I'm a lawyer, so I know how government and how the hospital play their cards. And I know the communities. You know, like with our pickup truck that send people to get tested, they all the infection rate that we found out is with 10 people that we send to testing station, we found 50%. This is very accurate. More like at that time, active testing still hard to access, and because I know I work with the communities with the low income, so I have more information than anyone who is likely to get COVID. So with more pickup trucks that I send out, it's more people that we will discover how many people are infected by COVID. So I guess that's with my background, it's definitely influenced how Sendai moving forward.
Excellent. I'm sure that people have lots of questions for you as well. Is there anything you'd like to add right now, or?
Okay, so other than that, you want this to be like discussion or like lecture?
No, you can keep speaking, but there will be a discussion and questions afterwards as well. But if there's something that you'd like to, to add now.
Okay, so I guess if it's more like the topic that we discussed, how the charities or volunteers are doing in this COVID-19 is, I think this is probably the only thing that is good about COVID right now is that people start to have hope that all volunteers are coming out to help them, and I think it might be the only way that saves us right now from this pandemic. With all the volunteers coming out, showing the government how they should work, and it definitely affect how they work, because when the volunteers provide emergency assistance, the Bangkok Bangkok Metropolitan Authority start to do the same thing, CRCT or something like that. And
would you say that that reaction, the reaction of the volunteers, is that a reaction to a political response or administrative response or a lack of response from BMA or from national government, or from, is there a cause and effect between?
Yeah, I think it's cause and effect for sure. With Zendai that we provide active testing a week ago, we cooperated with แพทย์ชมรมแพทย์ชนบท the rural doctors club, which is one of the biggest doctor club in Thailand. We show them how we do active testing. We start from antigen test kit, and then if you're positive, then you get the RT-PCR, and then you go to the next station, you get the medication right away, and after that you can do the X-ray machine right away. Then we have mobile X-ray there. So we did this for a week, and it's over than 200 testing that we provide. And after that, everyone started to to copy and paste that models. I think today or 2 days ago, the military started doing this at Vipavadi. Port started doing this last week. So I think with the help and models and whatever the volunteers is doing, there will be the direct response from the government or from the local government to follow the models if it works.
Excellent. Thank you. Thank you very much for that. We will get back to. I can see the questions coming in now, so we'll get back to you with a number of questions. Bangkok Community Help. Well, first of all, Friso, we didn't give you a chance to introduce yourself. Would you like to? So, co-founder of Bangkok Community Help, but before that,
yeah, Friso Poldervaart from the Netherlands. Yeah, we co-founded the Bangkok Community Help Foundation. Similar, like everybody's saying here, without ever having the idea that it would come this far. Meaning that we would never think that we would be supplying oxygen to people. We'd never think we would have ambulances driving around. We would never think to have to help 80,000 workers that are stuck in construction camps. So it's constantly evolving, right? It was an interesting question, like when it was the moment that you thought like to scale up. I think for us it's similar. That moment isn't there, because it's just constantly evolving. So it's just getting more and more as the demand grows, as COVID surges. You know, the way to adapt is similar, right? It follows. It's almost like a trend. What's happening next? We had now we have Delta, for example. Before we didn't, right? So that, I mean, things are changing constantly. So we're constantly adapting as well. But the good thing is, I mean, I'm just going a little bit over the whole thing now because there have been so many good points. There is a lot of support, luckily, from individuals, from people that are, that are willing to help. We have a lot of volunteers from all over the world that actually, in the case of, being foreigners in Thailand, the passion is driven usually by the fact that they love this country. This country has given us a lot. And in good times and bad times, we should be here. We can't only be here when things are happening and great and the economy is doing well and everybody's having a great time. Now we should also be here to fight together.
For people who don't know, could you just say what you were doing here before before this became a full-time job?
Before it became full. Well, like Greg and me are similar. We're in business. I own a Dinner in the Sky, which is a restaurant we lift up with a crane 50 meters in the air. And yeah, I've actually been involved in quite a few different businesses here in Thailand, also in Europe. So that's the background. Our background is business, both of us. And again, this was also a point. We, I think, run it as a business. We see it as that because, again, to do this every single day, to, help thousands of people every single day, you got to run it as a, as a machine. It is a business. It's not just something you do on the afternoon and go into communities and say hello. I mean, it's real, I mean, the struggle is real for so many people. And again, the struggle has been evolving for so many people as well. First it was the economy, then things were better, then it was, for example, we work a lot in Klong Tay. Then it was the stigma against the people in, slum communities, that they were sick, that they had COVID, so they were not allowed to go back to work even if they had the chance. Then Delta came, then the whole construction lockdown came, then the short supply of beds, and now almost no supply of beds came. So again, it's a constantly evolving organism that we're working against, actually.
And can you say something about how you react to these new needs and these new? I mean, is there some sort of process or system, or is it just you wake up in the morning and there's a new problem and you have to solve it?
Yes, yes. We're I think this we are like that. I mean, it's just okay. A problem arises. Okay, what can we do about it? Help needs to be there now, and let's just go. We are very, very like that. I mean, we go, and then of course, by going, you develop a system and you start understanding. Okay, what is the actual need? How should we, from what angle should we attack it? But we are very, very much like that. Yeah, we just get out there. Supply the first aid, and then see, okay, how can we tweak this, and also how can we scale this? How can we help more people that will either face the same problem or already have this problem? So yeah, that's that's the strategy actually, just to get out there and go. And people that see that and like that, they are usually the ones that actually join us and do the same.
Can I ask how you started? I mean, what was your first project or your first operation?
Well, yeah. The first was in first COVID wave in April. What is it? 2020, right?
Mm-hmm.
Yeah. Similar like everybody's saying here. Starting, to see around us. I mean, we live in Klong Thai actually, and we see around. Okay. This COVID thing, it seems to be happening, and people seems to, trouble is ahead. At that time, the lockdown was incoming. The country was actually completely locking down. So we understood, okay, this is not gonna end well for a lot of people. And then similar, we started cooking ourselves, doing 100 meals, doing 200 meals, going by ourselves in the community. And from there, again, it just grew and grew, and we saw the demand, and we started understanding what kind of hardships the people face there. And from there, it's just been growing and growing because of the demand. It's following the demand, and the demand is following how COVID behaves. And at this point in time, it's very difficult. So, of course, the help is the demand for help is super high now.
On that note, is now a good time to show your video?
Yeah, I think that would give a good picture of what we do. Yeah, all the different facets.
Can we show the video?
The world burning. There's a shooting, there's a looting, there's a hurricane coming. And every day I sit and wonder what the hell we doing. I think I smell another war brewing. Sometimes I feel like I'm falling from a high wire, and I can't breathe in my own home from the forest fires. I got a friend who's now an angel, was a firefighter. He's looking down, reminding me I gotta keep on trying. If you met a stranger who was feeling stuck, and if you had a partner who was out of love, the world was down, would you try to pick it up? Like, is it worth the pain? Is it worth the second or two? Reaching out to somebody you never knew. Share it with a friend or two. They give it to 100 more. We'll pass it to 1,000 more. We'll give it to 1,000,000 more. And love is breaking down every door, door. Is it worth the pain? Is it worth the second or two? Reaching out to somebody you never knew. And love is breaking down every door right in front of you. Whoa, whoa. Whoa.
Could you give us a little bit of context, either one of you, Greg or Friso, a little bit of context about making a video like this and what what the goal and what you hope to achieve by showing a video like this?
Has Friso made them?
Yeah. Well, actually, my background is film. Actually, I studied cinematography. Well, I mean, I think we apply. I mean, it's almost like marketing, right? First of all, it's to show the donors what we do. The money is going to the communities for 100%. We show exactly how that goes. I mean, people can see, and of course, we want to inspire people when they see a video like this to either support us. This would be very great. But if they don't, and they decide to wake up in the morning and look around and help someone in their, in their street or in the community, that's also a big win for us. So, of course, we try to reach out through all social media platforms. We want to show also what's going on. We want to, we tell stories, right? I mean, people have stories. People can see on our Facebook page and on our social media. We tell individuals, people's stories too. What happened to them, how did we help them? We had we found a man gasping for air in the Klong Thai Lok 456 community, literally dying. And we said, okay, well, what can we do? So we raced down to a shop, bought the oxygen supplies, gave him the oxygen, he felt better, then we helped him to get to a hospital. That's the story we tell. And from that story, we get support. I mean, people see that, and we, of course, say that many of these stories are happening every single day, and if you want to help, then please do so. So it's of course very important to constantly show what we do, how we do it, and.
Greg, were you about to say something? You looked like you were. No.
Yeah. I mean, that's basically how it all evolves too, because you see the need, and it's good to get the word out there as far as what the need is, like the labor camps, where when we delivered the food, the people could see the people running to get it because they were hungry, right? They weren't getting food, they were locked up. The same way with oxygen, when someone is gasping for breath, and there's so many stories, one after another, and you just convey what is happening. For instance, yesterday there was a lady, her oxygen level was 70, and when I saw it, we have a doctor, a volunteer doctor and nurse chat. And I said, oh my God, we have to get her. Oh, she just actually came back from the hospital, and they can't do anything for her because the COVID is wrecked her lungs. She no longer has COVID, and the family's just requesting for her to die peacefully at home, and they're asking for the last canister of oxygen. So we delivered that, and then she did die peacefully at home last night. But there's where someone was kicked out of the house, and we got a panic call. There's a person here with COVID, and he has no place to go. Can you come and help him? And so we took an ambulance there to pick him up. People coming together in Bangkok, I think, is the most rewarding thing. But I think that there's other things that you see at the hospitals, and where they get turned away, and the emotions every day is changing.
Do you guys have a system for tapping into these how do you hear about these stories? How do you know which camps are not the construction camps are one of the stories that I think have impacted people a lot. How do you know which ones are not being supplied or not being what sort of communication network do you have?
What happens is one camp will talk about other camps, but also people reaching out and say, hey, I'm living right next door to a camp that I don't think, I don't see any supplies coming in. Then, of course, we call them up, we get the camp leader, and we ask questions. When's the last time you ever gotten anything from the company? When were you paid? What kind of donations have you gotten? And so we ask them many questions before. And, there's a lot of stories there where, a camp was told, we're not going to give you any more food because we're out of money. And, well, what do we do for food, boss? Well, there's a lake, go fish.
And that's when there's a lake.
Yeah. But
No.
it's similar. It starts from the grassroots, right? I mean, the camps were locked down. Okay, what are we gonna do now? All these people will be locked in there. They will have no income. They will not be able to, take care of themselves at some point. So we literally just drive up to camps, knock on the big gate, and talk to people. And then again, from there it evolves. Like Greg mentioned, they mention about other camps. We get out there again through social media, through internet, saying, okay, there are camps now that and the people are being treated unfair in some cases. If you know of any places, let us know. And then it streams in. I mean, it's Bangkok Community Help. The community is very strong. We get constantly, every single day, hundreds of messages of either people, giving their support, or also people asking for help. And that's what we do, right? So that's exactly what we're there for. So.
How do you is there a system for prioritizing, because if you get hundreds of requests, you can't possibly answer all of them every day.
Yeah. Yes.
Is there a method or a system?
Well, I think that when it comes to the camps, we've never denied. We just get out there. I think when it comes to the medical, our doctors and nurses that on our chats, they basically take the attitude, we're not going to be able to help everybody, but we're going to help as many as we possibly can. And on those that we do help, we're going to focus, and we're going to see it all the way through. And if it's pretty well overwhelming, of course, all the cases. I'm sure Zendai has the same feeling that it's just like overwhelming how many people are reaching out asking for oxygen or that, and you just do the best you possibly can, right? So.
Great. Is there anything else that you'd like to add to about what you're doing?
Right.
I'd like to point out just because it's a question that's popped up a couple times in the feeds that I'm watching. People are asking how they can contribute, how they can donate, whether it's from within Thailand or outside. I just wanted to say that we've linked to every group in the Facebook feed, but we will repost all of the pertinent information that you'll share with us afterwards for all of your organizations.
Okay.
So for anybody out there who's wondering how they can help, you can contact each group directly.
Okay, so let me, when I was doing the introduction, we were talking a little bit about, I think there was a question as far as business and how a foundation goes hand in hand, the skill set. For the people that don't know, I own Sunrise Tacos, which is a large chain of Mexican restaurants. And fortunately, I have a great management team that allows me to do this, which I have a lot of passion for as far as Bangkok Community Help Foundation. But it all lies in the staff that you have along with the management that you have. So when it comes to Bangkok Community Help, we are based on the volunteers. If we don't have the volunteers, if we don't have the support from people, we're nobody. There's two of us that we could never do that much at all. It just it's like any big corporation. When it grows, it has to have people surrounding itself, good people. And I think that's the most enlightening, bloody great thing about the COVID is the community comes together, and we're surrounded with a lot of great people. and that's how we've involved. And so, yes, definitely support is fantastic, and not only just monetary or physical donations, but or oxygen. It's also as far as people that volunteer to get involved.
Yeah.
You know, we're doing a number of new isolation centers, and we have a tremendous need for people that have medical background. You know, it seems to be a big shortage right now, so that is something we're looking forward to also.
I mean, if you're talking about the resources and the people that you have helping you, the volunteers, does that become, I mean, again, to frame it in a business context, does that become a managerial human resource kind of question for you? I mean, is that how you manage these things, or how you manage those resources?
Well, we have a volunteer coordinator group. There's 3 of them, and they do a fantastic job. They are the cream of the cream.
Yep.
And so they have the respect of the volunteers. And so we could never in 100 years manage the volunteers as far as what they need to do and help, and especially with the regulations as far as you can only have 5 people at one time helping out. And so they manage and they do a fantastic job. So yeah, you have to surround yourself with people in different divisions that are doing things that you need to be done in order to accomplish your end goal, right?
Well,
What do you say on that?
Yeah, I
Jason?
know, when people do that, I mean, people rise to the occasion. I mean, you know, they start volunteering with us, and yeah, just rise to, you know, to start take the lead, start taking, you know, care of a group of people or of a large amount of people, direct them, tell them what to do. And we make it I mean, it's for us very important that anybody who wants to be involved, like Greg mentioned, physically can be involved. It's important for us that people are able to do that, because.
So can I ask a question about, I mean, if Greg said that, for example, there's a shortage of medical personnel or qualified medical assistants,
Yeah.
can you go out, is there a way to reach out to that particular group of people and say, you know, we need doctors, we need nurses, we need people with knowledge? Is that something you can proactively do, or is it you have to wait for people to show up?
No, surely proactively as well. Yeah, I mean, we're very vocal always of what, you know, what we're in need of and what we're lacking, and usually again when, you know, the one doctor joins, you know, that's either from our own network, that's from our friends' network, and then obviously it opens up. Then, you know, they know people that want to get involved. And there's many people in this case and in this day and age where, you know, meeting people is not really a thing. There's many volunteers, for example, in our doctor group that we have never met before, right? These people, you know, we know them only through online, right? And they're doing such a tremendous job. I mean, they're not stopping. It's 24 hours. So everybody's working for this same goal, right? And that's to help people. So it's again, COVID has destroyed a lot of things, but I hope that it also has showed a lot of people that actually people can come together and do good for others, and this is a very beautiful thing, and it's something we should never forget from this time when we look back and say, wow, it was difficult, but it was beautiful that we all stood up and did something about it. And I think that's also a lot of respect for the other people in the room, because in the end it's only about getting out there and doing it. I mean, it's there's no time to think, there's no time to consider. If you want to help, you should do it. It should be now. So yeah, a lot of respect for everybody that's doing that.
Well, that's actually a nice lead into my next question, which is what happens next, or what happens when this moment of immediate need and crisis, hopefully not too long of a time, will be behind us.
Yeah.
What happens to this? You're talking about people, building something and building this connection with people and people coming together.
Yeah. Well,
Is this something that you want to? So the question is this something you want to maintain? And if so, how do you keep that sort of momentum?
Yeah. Well, 100%. The introduction was interesting because for us it's actually flipped around, right? We started because of COVID. Many foundations or charities been there for a long time and then needed to shift their focus to COVID, right? So for us it will be the other way around. And COVID has literally been the eye-opener for us to understand exactly what's going on in all these communities and what long-term solutions can be provided to them. So we really, we can't wait to when all of this is over, to focus more on that. To teach kids, teach adults, build housing for people. We have done in the past already when COVID was a little bit to the background. We turned a garbage dump into a park. We built a house for people. We have houses waiting to be built. A house with 21 kids that are all living under the same roof. But when it rains, it becomes a swimming pool. So this is our vision. Of course, it's needed now to feed people very hand to mouth, right? You go there today, you give them a meal, but tomorrow you have to come back again, right? So it is about not giving the people the fish, but teaching them how to fish. The only problem is that right now isn't possible. The need is so high that we need to get in there every day. We need to support the people to survive to that time, and then we will definitely change our focus to more longer term solutions, develop the communities, develop the people there, give them the skills to actually, get better and, improve their life, basically. That's what we want to do, and we will do that as well. So future is, there's a lot there that we will do and that we are looking forward to. But now again, the focus is just on getting there, right, to that moment when we can finally do those things.
One of the things we have is 85 international teachers that were teaching the kids, but that's on hold because of COVID, right? But they're anxious to get back into the thing. Our carpenters are anxious to get back and build houses, and that is the change, right? That's what's going to get people out of the slums, is education. So we're anxious for COVID to get over. I think we all are. But that is something that you really do change lives, as far as when you're talking about education, or taking a garbage dump where 300 kids are walking by after school, and then there's so much disease, and now it's a beautiful park. It's a fantastic feeling, to see that in action. And so that's probably the highlight of last year, was that moment. And the kids were actually playing with it for many, many, many months, until now it's not the case, because everybody's now stuck inside.
Can I bring Kun Sarawit Champ back into the conversation for a second? Because you were talking about how you marshal resources and respond to a crisis. It's getting a little ahead of ourselves, but how do you manage the end of a crisis and the end of an emergency? Is there a transition, or do you have any thoughts on how, what happens next, on the assumption that maybe in X number of months we'll be in a better place? What do these groups do, and how do they capitalize on the resources that they've brought together so far?
Okay, so I actually split my head into two to address this problem from the pandemic. And also, when you asked me about what's going to happen next, I actually wanted to ask my fellow speaker as well about your thoughts against the future plan, the coming plan within the next 3 or 6 months or a year. First of all, I actually co-found Food for Fighter with my aunties to address the emergency relief. That's the first. The second one, you know, is as the PSAC said that it's not enough to actually doing about emergency relief. We need to focus on the long-term plan and sustainability in the future as well. Since March last year, when I was actually in the quarantine, when I flew back from the UK, we were talking. I was talking with the community development department, who actually responsible for all top entrepreneur. At the time, we kind of know that the budget for the all top entrepreneur to organize such an event at the hall or the department store going to be canceled. So I actually asked them to move the budget to support those community entrepreneurs, and then talk to a lot of online platforms, as I mentioned before, such as JD Central, Shopee, and Lazada, to provide a free space for the community entrepreneurs, and then to give us a lot of support, such as trainings, you know, how to do online selling, because those people never learn how to do it, they don't know how to do it, and it's going to be a start from them, and it's not easy. And then I help them do the promotion and, you know, marketing strategy and PR, and help them sell. This has been very successful. Now with OTOP, I've been doing with them for the third campaign already, and then I can actually say, and I'm proud to say that now we actually sold over 70 million baht, and it's very touching when I talk to the entrepreneurs. One of them come from Chiang Rai. They live in the mountain. They actually have a coffee shop, and they always like welcome tourists, you know, both from domestic and international countries. And then once the COVID happened, lockdown happened, no tourists, no visitors, no income, and we brought them to the online stores, and then they actually sell. You wouldn't believe that they actually sell 50,000 baht to 90,000 baht weekly from March last year until nowadays. So I actually use this model to expand, and then talk to other government authorities, such as National Housing Association, you know, Office of the SME, and so on, to use the same model. But then we focus on different group of people, like lower income people who stay in NHA, and then at-risk, you know, women who used to be entrepreneur, but then got affected as well, and so on, yeah. And then when you ask me about what's next, I would like to discuss with the speaker as well, because I feel like now we are, you know, working very hard to address the pandemic problem day to day without knowing where is the end. But what we know right now is the problem now shouldn't be this severe if the government structure, policy, and direction are much better. And even now, like we try to raise fund, we try to help people, you know, we don't know what's the end. And every day, like for example, like Food for Fighter got like thousands of calls, and we can't even handle it. You know, people in the queue waiting for us to help. And also the surprising story, I must say, that some of the people who asked for help called us and say that actually they called the government, like 1330 1669, and the staff of the government asked them to call us. So you know, we were a little bit surprised, and you know, feel sad at the same time. Even the government couldn't create such a structure, the effective structure to address this problem. At the same time, they transfer those calls to us, the small people. But you know, like even though we gather together with Sendai or other network, you know, a lot of volunteers, it's not enough, because that's not the structure that we can make. It's not a policy we can create, you know. Yeah.
Okay, so can I ask somebody else? Maybe Chris, you'd like to take this question. Who do you talk to? Who are the authorities? What level do you talk to people? Do you talk to people at the district level, at the municipal level, at the national level, ministry? Who are your public who do you engage in these sorts of questions?
So, at first, we didn't talk to anyone, and nobody talked to us. It's just like that. But at just a little over than 2 months, I think, at that point in June or at the end of June, the government start to recognize that more. So they start to at least open and give some volunteers groups a chance to speak with them. Okay, so at that time I didn't thought that it could be possible because we're so rogue. We just like started our pickup. We have one pickup, and when we borrow more pickup from my friends. So in June, I think we have 5 pickup trucks and a little more than 10 ambulances in our network. At that time, anywhere we go, it seems like we are. I don't know that how they feel, how the local officers feels about us, but at first we didn't actually encounter them much because they are not there. It's just us. So we don't talk to anyone. We provide help and support. Nobody talk to us. It's just like that in the first 2 months.
Does anybody here have a different experience or a similar experience?
Yeah, but I think once they started to recognize your organizations, at first, and that's kind of feeling that they don't know you before, but at the end, when they started to at least accept your identity, then
Yeah.
I think it'd be okay. It'd be better later.
Well,
You
so I
see
mean,
the same, yeah.
so opening the dialogue is obviously the beginning, but once that dialogue is engaged, do you find them supportive in other ways, materially, or making processes or bureaucracy easier, or do they do more than just listen to what you have to say?
Okay, so there's one incident that พม กระทรวง พม asked us กระทรวง พม which is Ministry of กระทรวงพัฒนาสังคมและมนุษย์ Human Development and Human Security or something like that. I don't know the name in English. And they asked us to deliver, to send one patient to วชิระพยาบาล โรงพยาบาลวชิระ and โรงพยาบาลวชิระ they told us that they already talked to พม already พม told us that they already talked to วชิระ but at the end, like the government actually are fractured and they don't talk to each other too. They thought that they told us that they talk to each other. They told us to bring the patient to the hospital. We bring patients to hospitals and the patient need to wait there for 3 hours in our ambulance, which is crazy. And this problem never been solved. They still don't talk to each other. When we say government, you need to, they are separate into different agencies and nobody talk to each other, which is crazy. I don't know what to say about that. But later on, I want to show, I want to present this to the people, to the audience that สภากาชาด Red Cross asked us to be in the more like a Paki, like union of volunteer groups who providing COVID. Then they started to listen to us more. So this is probably the only support that we get from the government. It's not the government, it's just from Red Cross. And Red Cross introduced us to Ministry of Public Health. Red Cross introduced us to the COVID Command Center, the central one that control everything in Bangkok. I don't know the word in English, but in Thai it's สปก สบค กทม. And it start to get better from that point, from Zendai experience. I don't know about others.
Sax, do you have a similar? Do you engage public institutions very much, or?
I think for us, it's really much about maneuvering because we depends, like he said, it's about depending on what level of government. So we already work with health centers. Health centers is a government organization. So we've been
at a very local level, at a very district.
Yeah,
level.
district health centers, and they've been amazing. You know, like each health center has one doctor and several nurses. They are all overworked. They know each person they know who's bedridden. You know, hundreds of people. These nurses go in. They know who's bedridden. They know who needs. They go in to check their diabetes. They do so much work, and we've been working with them since the beginning and even before COVID. So I think it's I hate to say it, like he said before, it's a very Thai thing. It's trust. You know, it's you know, so once you know you have that trust, you know, then it's just about communication. You know, two things that I've always learned working in this field is planning and communication. You know, I see that problems with that a lot, especially during COVID. Like you said, people don't communicate. It doesn't have to be with government. Like I've been working in the NGO sector for 10 years, and not all the NGOs coordinate. You know, like there's so many people doing the same thing. You know, so it's about communication, and I can't speak from a higher level. You know, because I work with districts. I work with health centers, but my experience with the health centers have been quite supportive. Of course, you get the occasional, you know, here and there where they're like, you know, where are you from? You know, so that's the first question. Who are you? Yeah, you know, so you know, so that happens.
So that was one of the online questions about who you talk to and how you engage them. A question specifically for Kun Chris and Zendai. Why, in his view, has the Thai government and private companies not been more proactive to help with COVID-19? Not at all a leading question.
Yeah, I'm not the government. I'm not from the big corporation, so I'm not sure why don't they take initiative earlier, but maybe it's just a lack of I think it's a lack of urgency within their mind. I think they know the problems, but they don't see it coming. It just they know that COVID is there, but they're not sure whether what should they do. They're still confused. And I think government and big corporations have a very good. I think we all have a same goal. We want to eliminate COVID and get back into work, and I don't think anyone is trying to make this situation worse. But it just.
Okay, well, so this sort of actually leads nicely into the next question, which is one viewer asked the question, tells the story of two families that had difficulties getting health care, getting care during COVID care, and the question is there actually a protocol? Is there when somebody needs help, are there steps? And this is a question open to all of you, and you can share your experiences. Is there when you have an ambulance sitting outside a hospital and there's no that you were told to go to and there's no bed, when somebody needs oxygen for whatever reason and there's no oxygen, what's missing? Why are there rules that should be followed that aren't followed, or is it just a total absence of rules and protocols, or is it and what can be done about that?
Okay, so let me just try to answer this question. I think that when the emergency calls, there's supposed to be a protocol, right? There's supposed to be a protocol that trying to save lives as many as they can. But what happened now is when you call 1669, nobody answered. That's the first thing, right? So the protocol is not followed because nobody is picking up the phone. That's first thing. Even if they pick up the phone, the protocol said that they can only send out emergency unit if there's destination. So when the beds are full right now, so there's no destinations. So they're not sending out ambulances to save lives. So that's why Greg has to go out. That's why Zendai need to go out, because the protocol locked them up, lock the agencies up there, lock up the people who has the duty to do these things.
Yeah.
So I think that's when it's wrong. That's what is wrong here. So the people follow protocols and pay attention and giving weight to protocols more than saving lives, more than pay. Yeah.
And what does anybody have an opinion on how that could change
Yeah.
or
I mean,
improved?
I think in general, obviously the strategy in Thailand was always, if you have COVID, you go to a hospital and you get treated. Obviously that doesn't exist anymore. That's the past, right? There is no such thing. I think there's also, and this may be a bit controversial, but we see it, and we are wondering if the others have it as well. There's also a lot of panic. Once somebody finds out that they have COVID, they will, in some cases, do whatever they can to get a bed. But in not all cases, that's needed. So we have a lot of calls every day of people saying, "Oh my God, I have COVID. I need a bed now." And after less than a minute of talking, which is, "What are your symptoms?" Not so much. "What are your O2 levels?" They are 99. Okay, you're okay. You can isolate at home. You can actually, sorry, you can actually sign up for a program, a home isolation program. That, I mean, again, if that works is another thing, the program itself. But people need to understand that home isolation, in many cases, is a better way of doing it than, for example, going to a Longbaan Sanam, like a field hospital. Because you don't wanna be there. To be honest, it's not fun to be in a field hospital. If you're able to quarantine yourself at home properly, which unfortunately not everybody can. That's, for example, why we're building these isolation centers, to give people the opportunity to do that. Then that should be done. So, of course, it was very beautiful that Thailand was able to treat everybody that had COVID in a hospital. I mean, fantastic. That's not possible anymore. So now that, that beautiful program that we had here is now fighting against the situation, because everybody immediately thinks they need to be in a hospital, and that's not always the case. I think that's also important for people to understand, I think.
Do you see an official policy shift away from that? I mean, because technically everybody who's diagnosed positive is supposed to go into a hospital or field hospital. As you said, it's materially not.
It's not possible. Yeah.
Not possible.
No.
But is there some sort of policy shift in? Or
I mean,
this is a question for any of you.
There is the home isolation program. What is it? 1334, where you sign up. The government knows that you have COVID. They know where you are. They'll send you meals. They send you medicine. And this is obviously definitely a shift in the way the government is trying to attack the problem, by actually starting to support people quarantining at home. Right. Now, the system itself, some people are waiting very, very long to get the medicine, to get the proper, get actually the kit that they're supposed to get. That's something we can help with as all of our groups. We can do this. I mean, we can provide the oximeter, we can provide the, some of the medicines, the Favi medicine that's very hard sought after, is something that the government should actually open up for private citizens to be able to buy. This would be already a big change. This is controlled now, so everybody's waiting for this. Yeah, Favi, it's called Favi. Favi, exactly. People are waiting for this, right? This is the gold right now, and soon, if this continues, we will have a shortage in Thailand, because I think it was in the Bangkok Post, 1 million tabs a day. So soon they will be out of supply, right? So yeah, that can be another big problem again.
One of the things that we found is on the 1330, as one of the doctors said, you may as well be calling a fortune teller. Because, we've had cases where people waited 6 or 7 days. And so the key is to follow up. If you don't hear back after 1 day, after 2 days, you have to just follow up.
Yes, yeah.
But the FOBI is the most important thing, and what most of the doctors say in day 2 to get it. And so it doesn't get into your lungs, So on day 6, day 7, you're going to reduce that viral load. And that's where so many cases where they said, I did register with 1330, I never heard anything back, and all of a sudden we're hearing the oxygen levels way low, and it's just never needed to get that way, And so you just have to, if you do register at 1330 on home insulation, the
isolation, yeah.
home isolation, you have to follow up.
Constantly,
That's really key, really.
But it's
key.
open for foreigners as well.
But we have the same thing. People say they call it 1669, and
There's not even someone picking up, yeah.
But it's
or they get put on hold and they get transferred to another,
I was going to say, it's because the system is so saturated. It's not like
Well, they
some
need to put them
of the
somewhere,
calls
right?
obviously get through. I mean, somebody is.
So
But-
exactly, yeah. Because the demand is probably so incredible, right? That's like why we have to step in and support. I mean, literally with all the things we're doing in cases of handling COVID cases, bringing them to hospitals, testing people, building building community isolation centers. We're just taking the pressure off the hospitals, right? And that's why again it's important that as a citizen, as someone that has or might have COVID, to also understand that if you can, keep the pressure off the hospitals, because the hospitals are full and the hospitals need to be used for the people that are having heavy symptoms and that need immediate care. So we all need to do our part in that, actually.
Just a very specific question that I will ask Greg and Friso, because if you've been working with other foreigners and other expats, there's a question about people on OA retirement visas who are restricted from doing volunteer work. Have you encountered that, and has that been an issue?
No, it's not an issue actually. No, it's I guess, I mean, if you look at the law, maybe, yeah, that, but in the end, it's.
Nobody's come to pull
No,
a volunteer
no,
out
no.
of the line to.
No. We're very fortunate to actually, I mean, have good support from also some government groups and individuals that support what we do, and that that let us actually do what we want, which is very good. But no, we have no. That won't happen. I guess we can guarantee everybody that wants to help can help.
We'll find a way to help.
We'll not run into any
Okay.
problems.
Can I ask? That leads me to another question that I wanted to ask Sakson in particular, but it can apply to all of you as well. A different group of foreigners. You've worked a lot with refugees who, it seems, again, don't necessarily fit into the system a lot of the time. Can you talk about that and how you've been reaching out to some of the communities that you were already involved with before COVID even?
Yeah. So basically, I run a place called Na Projects. So we're a platform for NGOs. We work with Asylum Access Thailand, which is we do livelihood programs for urban refugees. There's over 10,000 refugees in Thailand from all over Syria, Afghanistan, everywhere. Pre-COVID, it actually was getting a bit better, because a big issue with refugees in Thailand has always been classification. So what they used to always do is they just throw, if your visa is overdue, you're a refugee, you're a migrant worker, anything, they throw you in the IDC. Like, so, they jumble you up. Pre-COVID, actually, a new law came out. The government had a law of classification. So people are starting to get classified. There are people who they usually have a process. So Thailand is a country where it's like a layover for refugees before they go to another country. So what we would do is we do livelihood programs, we do food training, we do business training in order to get them ready for the next country. Everything was semi-picking up, and then COVID happens. It's just like a door is closed. All those countries, like one family I work with, a Pakistani family, another one, an Afghani family, they got accepted to Canada. But there's a whole process. They already got their interview, so they got passed. And then COVID happens, they can't get their medical checks. They can't. The countries, the borders are closed. So from all of a sudden getting relocated, they're stuck. And there's families who've been here up to 10 years. They're still waiting their process. So COVID has just shut the door. And they get some support from NGOs like UNHCR and BRC NGOs, but it's not enough. So they're the people that are people don't see, and they're really struggling. But they're also, the organizations know where they are. There's prioritization as far as food and stuff like that. So I mean, I'm waiting for the border things to get better, so these families can kind of start going to other countries. With what's going on in Afghanistan, we're going to see more refugees come over, through other ways. So I think it's something that we have to be prepared. These are people who are skilled. There's chefs, there's doctors, there's lawyers, there's architects. So we have to be more open about policy work as how we can provide maybe for them to stay here. So that's kind of been limbo. I guess limbo is the answer now. They're all in limbo.
I mean, and it was sort of the case even before COVID.
Yes, before COVID, but at least there's a light at the end of the tunnel. Now it's just like when they gotta wait and everything. It's like starting over, So they open up the borders and they have to go through all the paperwork again, or maybe the case is closed. They have to reopen it up. It's tricky. Yeah.
Does anybody have another group, foreign or not? Does anybody have anything to say about informal workers and people who don't necessarily qualify for? You don't necessarily have the paperwork to qualify for aid or assistance. And Chris, go ahead, please.
We have received so many requests from illegal immigrants during this COVID time, and at this moment, right now, there's still no agreement how we gonna deal with this group. When they go to testing station that provide by BMA, they are denied to get testing there. Even if they have result, maybe they go to private lab and get a RT-PCR result and give it to Sendai. Sendai try to forward it to as many few hospitals as we can, or to all the hospitals that we deal with them. Most of them are denied. How we actually help them is if any cases, if they are so severe, we will actually need to call each separate hospitals. We will call the director of the hospital directly and ask them for their kindness. This is so funny, hilarious that we let them survive without any systematic support, which is I don't know what to say about this. I've been telling anyone, any government agencies that I know, anyone from the top, from Atipadi, the director of each Grom, about this problem, and nobody can solve it yet. Now it just depends on luck and chance, sadly.
And somebody going to the director of the hospital and begging for a spot.
It's all begging. And they, before, in the first month, in April, That's actually testing stations at Sanam Tu Patemi or Thai Yipun that actually accepting them, and then I think there's a conflict within the government between Ministry of Labor and Ministry of Public Health, and now they still that conflict is still exists. No, basically, the reason that nobody is actually providing support for them is because the government still try to figure it out who's gonna pay for the bill. Does it come from สปสช or does it come from any กองทุน any funds? They still trying to figure it out,
And so they push them into the other.
so they
Camp,
just
yeah.
they just basically just leave it there for 3 months already. Anyone who could survive will survive. Anyone who have a right kind of boss that will pay for their bills will survive. Anyone who are so poor and probably unemployed and probably get a COVID and turn out to be yellow or even red kind of condition for patient will die on the street. Game over.
Can I ask? I mean, I'm not hopeful for a very positive answer, but if you're talking about even access to testing or access, to basic care, what are you seeing on the ground in terms of vaccination, in particular for communities that are foreigners, refugees, informal workers, people who are not necessarily in the system? I mean, it's hard enough for people who are in the system, but I mean, what do you have any thoughts on where that's going?
They're vaccinating all the construction workers.
How are they doing it? Are they going from camp to camp, or
I'm sorry, what's that?
how are they doing it? Are they going from camp to camp, or
No. They go to, where was that office that we went to and we
this-
saw them bringing in the
there's a few.
truckloads?
Yeah.
What was
so
that
they
building
they
again?
bust them in, they truck them in, and
Yeah, but we went there and it was in a meeting and they had agreed. The biggest issue is also the other migrant workers that work as nannies. So many nannies in the last month have become infected with COVID, and the employers just wanted them out of the house. We had many cases like that, and they were not in the system. But as far as getting vaccinated, this is it's not happening, especially with the Burmese and Cambodians,
Also,
and so that's why they're getting infected as well.
So can you tell me, do you know anything more about the policy to vaccinate people in the camps? Because I think you told me last week that you identified over 600 camps in Bangkok, right? Was that
611 camps.
600?
Yeah. Approximately 80,000
Does that mean
people.
that all 611 camps are on the list for vaccination, or?
Yes.
We were told that they're going to vaccinate the people that are in the social system and not in the social system. The employer just pays 50 baht to get that done. However, we've run into some camps where the people that were in social system got vaccinated, and the ones that were not in the social were just told, we'll get you later. So that was actually opposite what we were told before. So,
Yeah. Plus that also, the program started to vaccinate these 80,000 people, but at the moment of starting, they had no idea if the amount of jabs, how they would procure these jabs. So they started with 10,000 people first shot, and sort of went along, right? So it's still unclear if the second jab will come, when it comes.
right. Because they said they had a commitment of 60,000 shots, but they had no clue where they're going to get this second shot
Exactly,
from.
where they would come from.
They said we'll get to that at that point. So, as far as if you are from the bordering countries and you're in Thailand, that group is the one that's really hurting. And then, of course, the asylum seekers, the Pakistans. This is not a good place to be if you have COVID.
No, very difficult for them, yeah.
I think Chris mentioned before.
I just want to add a bit on that is maybe the only way that this group can get vaccinated is to wait until the end of the day. There be shot left at each settings at each stations, and sometimes if anyone, I don't know, who's listening to this could get this as a tip that they could wait there.
But
and wait for
sometimes
the
it
luck
works,
to
but,
happen.
but a lot of times it doesn't. And
Yeah, a lot of times it does work, a lot of times it doesn't, but
and technically, they are discouraging walk-ins now.
yeah, I know that, but
But no, but the,
It's live from
the
back,
answer is
yeah.
that technically,
Wow.
practically there are leftovers at the end of the day, and hopefully you can get some of the last doses. And I certainly know people who have done that.
I think Chris mentioned something actually that I think it depends on the owner too, because these are private construction. These aren't public construction companies. Today I was at a site, everybody was vaccinated because the owner took responsibility and paid. And then I've been to other sites where they don't even get food.
Yeah.
So, but I see a big condo coming up. So it's not like it's not, so I think it's something that has to be spoken about is private sector taking responsibility.
Definitely.
Because the vaccines, obviously they are there if these companies today can pay for them, So I think it's case by case and about people taking responsibility of their staff and their workers.
Yeah.
And that's
But
something
if
that I
the-
wanted to go ahead and.
So yeah, I mean, of course, they should be held liable in the case if they don't. I mean, how is it possible that well-renowned construction companies in Thailand are just letting their people starve to death in camps? I mean, that's crazy. That should be impossible. If
Well,
they get away with that, that would be that.
Well,
would
I was
be
going to say
very-
two things about that, and maybe this would be a good place to sort of wrap up this conversation as well. One, I wanted to point out because the construction camps have been such a flashpoint for people, people finding it outrageous and inadmissible that it's not, and as Sachs pointed out, and as both Greg and Friso have pointed out in their videos and their social media, it's not everybody. It's not every employer. It's not every
No,
construction site.
definitely.
It's not every developer. It's not systematically people. They're not 80,000 people completely starving to death. But there are owners and there are developers who have turned their
cases,
back. So I mean, just to make it clear, it's not across the board, but there are different different reactions and different.
Right. I often say there's 611 camps. So just imagine you put 611 people in a room. Some are going to be good people and some are going to be bad. And unfortunately, we see one camp here being well taken care of, and you might go 200 meters, not even 200 meters,
next
and
door,
it's totally where they don't get any food. So it's just like if there's 611 people in a room. So it's there's many of them do take good care of the people. They've gotten them vaccinated, but there's some. What are you thinking? That's.
Okay, so a last question for everybody.
I want to add on that.
Sure.
One thing that actually with camps, one thing that I still don't understand until now is the order to shut down all the camps and prevent people from getting in and getting out and providing zero assistance.
Right.
Which even actually create more problems than I mean I know that the official order they intend to control the virus from spreading out, but you just cannot do that. Humanitarianly, it's just against anything in this world that you just let those people die with zero support and let that be the duty of Greg and it's just crazy.
Yeah, that's when we talk about sort of accountability and liability. That's obviously where the key is, because if no one is held liable and if there's no accountability, then why not?
Well, this is you took my last question, the words of my last question out.
Okay,
not just out of my mouth, but last night. So a shameless plug for the FCCT. We had the Thai filmmaker Pichapong, who, last night in a live discussion about Memoria and the installation that he's doing at Tonton. It's opening later this month, and as you may know, he has very clear, strong political opinions, and his one of the questions that he brought up was, what do you do about responsibility and accountability, and in this context, in a crisis like this, what do does anybody have any thoughts, any comments, any finger pointing or not finger pointing or?
Well, I think it also, like Chris mentioned, I mean, it's like maybe in some cases we pioneer a little bit the way how things should be done, and if we talk about showing it to the outside world, that's usually what can make a change, because that's usually what's not so liked, when suddenly the whole world can see that there is something going on, there is a problem, there is whatever problem there is. So again, showing what's going on, telling stories, being honest about it, this is very important, because then usually change comes. When it's when the wound is open to see for everybody. I think this is important to keep doing that.
So I mean, between an open wound and is there some sort of, I mean, in English people talk about naming and shaming. Is that part of, I mean, does there have to be somebody, does the blame have to be put somewhere or not? Anybody?
Maybe at the end, but now it doesn't matter who. I mean, for ourselves, I mean, we don't think, or we don't have time to think about who should do what. That person should do that, and that, whatever government agencies should be there. It doesn't matter for the people that need the help. It doesn't matter who does it. It can be even to foreigners. It doesn't matter who does it.
The need is so great right now that it doesn't.
That's the thing, right?
Now is not the time.
There's no. So later, yes, for sure, but now there is no time to think who should do what. The only thing that counts and matters is to do it.
Two last quick questions, and then we should wrap this up because we've run over a little bit in terms of time, and people have to get home for curfew. One quick question is there one Thai partner, one Thai company that you would like to partner with, and whether that's in food, resources, logistics, anything else? I'll throw that out to you if you want to
Yes.
wave a flag at anybody and say,
Yes.
hey, we're over here. And then last question, civil society is doing good work, but government wants to clamp down on NGOs and forcing them to register, for example, with this new bill. Does anybody have any opinions or comments on that in the context of COVID? And you have 2 minutes, and then we'll wrap it up. So the NGO law, and private sector sponsor.
Yeah.
Who's your dream date, and second question, do you have anything to say about the NGO bill?
Well, for the partnerships, we've seen. I think it's called G. It's Ford, right? It's Ford trucks actually that are supporting you also, right? So this would be I think you can hook us up easier than us putting it here online. But we need trucks, so if anybody has trucks, please help us.
You need ways to move stuff around.
We need to transport people. We need to transport necessities all the time. So yeah, we need that urgently, actually.
Yeah, we need that too.
Ford,
we
you're
have
out there.
Now we have 7 trucks with more than 20 ambulances, but it's not enough. So any private company that have trucks, please
Share.
Yeah.
Saks, any wish list? Any?
Not really. I mean, because we get continued support, and we want like everybody's support is important. You know what I mean? From the person who's sending rice from their house to the Thai Union is giving us fish. AP.
But is there anything missing, sort of glaringly missing right now?
No, but to keep on doing it. You know what I mean? This is not over anytime soon. So if you ask me tomorrow, I might need rice. If you ask me the next day, I might need fish. If you ask me the next day, I need antigen
Because
tests.
your needs are constantly
Yeah,
changing.
antigen. We're working on antigen tests right now. So we need funding for antigen tests.
Kuncham, the groups that you work with, if you had a wish list, an ideal sort of,
Actually, we've got a lot of support, like volunteers and pills and food and stuff. What me and my network really need now is the easier and the convenient accessibility from the local government when we contact with the hospital, when we need to deliver the pills and the survival bag across the province. We still got blocked from the local police, from local authority. I actually want that support. I'm not expecting anything from the higher level of the government, but if the local authorities give us the easier assets and more collaboration, that would be great. Yeah.
Great. Quick reminder, does anybody have anything to say in 30 seconds or less about the NGO bill? Or is it not the time or the place?
Okay, I can say little thing about that, but I just realized that I actually need a date. Okay, so first of all, I think if anyone here, I've been talking to several delivery companies. Sendai wanna do home isolation.
Nice.
We're by ourselves. We have doctors. We contact the Red Cross to dispense us the favipiravir and some other medicines. But other than trucks, we need delivery companies to send all those favipiravir to their home. I've been talking with some companies, but I know that the cost is so much here, and it's a lot of money. But if any private companies that do such a kind of that service, please contact Sendai. We need help.
Name names. Do you want?
Okay. We want you. Food Panda, we talking to you. Grab, we already talking to you. We haven't talked
Lala
to
Move.
Lala
everybody.
Move yet. We haven't talked to Flash yet. We haven't talked to Line Man yet. But we all need help here. And please, if you can, anyone, we need you to send medicines to their house. We need that so much.
Wow.
Yeah.
You really
And-
need that last mile, that last kilometer to get the stuff to.
Yeah. Right now we're using our own trucks to send them, but it's not as fast, it's not as efficient to do that. So we need that. And okay, just to answer a little bit about the NGO bill, I've been following it a bit, and it seems to me that they want to control several things. I think I read lastly that they want to control salary, income, and with a lot of things. I'm not so sure, but because Sendai are not organization yet, we are not registered as foundation, so we're not affected by it. But I think this is good thing about Sendai because we are not controlled by any kind of forms. So we are flexible to do things. And flexibility is the most important in order to solve problems. So I'm not so sure whether it's the right approach to control the NGOs right now. So basically, I think maybe they should reconsider about issuing that bill. That's just my 2 cents. Thank you.
Great. On that note, gentlemen, thank you so much for your time. Thank you for everybody
Thank you.
who's followed us all this way through a long but very useful and very informative conversation. Thank you for your support of the FCCT. If you're looking for ways to join or to support us, you'll find that on our webpage and on our Facebook page. For anybody who asked how you can help any of these groups here, we will post that by tomorrow morning, and we'll have all the details to share. So please go back to this Facebook page that you're looking at and go back to our website tomorrow morning, and we will have that available for you. Thank you so much. Have a good night. Thank you, and ขอบคุณครับ สวัสดีครับ
ขอบคุณครับ
Come, come.